Welcome to Right Parenting Tips, your trusted expert guide on new age parenting, health and lifestyle. Coronavirus, tips to keep you safe. What is coronavirus? Coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS, and Severe Acute Respiratory Syndrome, SARS. What is COVID-19 or 2019 nCoV? COVID-19 or 2019 novel coronavirus is a previously unknown virus which was first discovered during an outbreak in China's Wuhan city and Hubei province in December 2019. The first cases were found in people coming in contact with live animal markets or seafood markets. This virus is probably a spillover from animals to humans. Now it is a pandemic. In March 2020, World Health Organization declared COVID-19 pandemic, meaning a worldwide outbreak with impact on society. What are the symptoms of COVID-19 infection? The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat or diarrhea. These symptoms are usually mild and begin gradually. Some people don't develop any symptoms and don't feel unwell. About 80% patients recover without any special treatment. Around 1 out of every 6 patients may become seriously ill. This is more like in older people, and those with underlying medical problems like high blood pressure, heart problems or diabetes. People with fever, cough and difficulty breathing should seek medical attention. COVID-19 infection is confirmed through a special test called PCR or polymerase chain reaction, which identifies viral genetic material. The samples taken from swabs from nose and throat. Sometimes even sputum or blood samples are tested. The diagnostic tests are usually carried out in government-assigned laboratories. So how to prevent coronavirus infection? There is no protective vaccine yet. So we will have to rely on general preventive measures to avoid this infection. Wash your hands often with soap and water for at least 20 seconds, especially after visiting public places, or after blowing your nose, coughing, or sneezing. If soap and water are not available, use a hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. Avoid touching your face, especially eyes, nose, and mouth with unwashed hands. Coronavirus infection spreads through close contact of less than 1 meter distance with a sick person and also through the spread of droplets when the sick person coughs, sneezes or blows nose. That's why avoid close contact with sick people. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. Most standard disinfectants are good enough to work for you. Shaking hands, kissing, touching noses or hugging are some popular forms of personal greetings in many cultures. Since they increase the risk of virus spread, avoid such physical touch greetings. Non-touch personal greetings like waving, nodding or bowing or Indian namaste are preferable in such a situation. Like for any infectious disease transmitted by close contact and respiratory droplets, it is wise to avoid visiting crowded places and events. Traveling in buses, trains and planes, either inside your country or outside, is risky in the current scenario. That's why avoid travel if you can. If it is essential, you can undertake that with due precautions. Stay home if feeling sick. If you or your child are feeling sick, then do not go to workplace or school or college. This will avoid chances of transmitting the infection to others. Cover coughs and sneezes. When you are coughing or sneezing, cover your mouth and nose with a tissue or do that into the bend of your elbow. Throw the soiled tissue in trash. Wash hands thoroughly with soap and water or a sanitizer afterwards. If you are sick, you should wear a face mask when you are around other people in a common public space. If you are not sick, you do not need to wear a face mask unless you are caring for someone who is sick, and they are not able to wear a face mask. Face masks may be in short supply and they should be saved for caregivers. There is no specific treatment for COVID-19 infection. Only symptomatic and supportive treatment is required. The sick patients should rest at home, avoid close contact with other people and pets, drink a lot of warm fluids and control pains and fevers with simple analgesics like paracetamol or ibuprofen. Saline nasal drops and warm saline gargles may be helpful. Antibiotics do not work against viruses and are not needed. With severe or prolonged symptoms, seek medical attention immediately. Breathing difficulty, pain or tightness in chest, feeling extremely weak or confused, bluish discoloration of lips or high fevers are some indicators that immediate medical attention is needed. High-risk patients like elderly persons or those with pre-existing illnesses such as high blood pressure, diabetes or chronic heart or lung disease, those with recent history of international travel or contact with a known case, should take medical opinion even with milder symptoms. Serious COVID-19 cases need aggressive supportive treatment in hospital ICU. COVID-19 infection has turned into an unprecedented global crisis. Beware of misinformation floating around social media to avoid panic. This video has been made using reputed reliable information sources like WHO, CDC and NHS. Share this info freely with your loved ones. Stay safe, positive and healthy. Let's help make a better new generation. Keep visiting Right Parenting Tips, your trusted expert guide on new age parenting, health and lifestyle. For more info visit www.rightparenting.com and www.healthvideotips.com. Concept creation, Dr. Manda V. Bishu.